in Louisville that it's still transporting people. While we are looking at all areas, getting our healthcare workers especially to the places they need to go, sometimes getting individuals that couldn't make it to their grocery store where they need to go is still critical. I know that the group that the question is about is looking at their policies, but this is one where we have to make sure that those where we need to get places can still get places. The second one is there any concern about the transmission of the coronavirus through the touching of gas pumps? Should we expect any forthcoming restrictions on gas stations? Gas stations need to stay open, but yes, this virus can live on just about any surface for a while. So use your hand sanitizer, bring it in your car, and or wash your hands after you use a gas pump. This is one of those areas where this virus spreads easily, and it's everywhere. Just because we haven't reported a county that doesn't have it, the coronavirus is there. So part of our daily lives are going to have to be the hygiene about when we touch things that are anywhere in public and making sure that we've done what we need to do to protect ourselves and to not spread the virus. Where do I stand on the need for a shelter-in-place order in Kentucky? Has it been discussed? So this term shelter-in-place, again, I don't think is descriptive, even though other people are using it. Shelter-in-place evokes emotions in us that are a deadly chemical spill near our house or even an active shooter. It says get in your house and board it up until we call you. That's not the way that we will address this coronavirus. Our way is healthy at home. That any type of steps, initiatives, restrictions that we put into place will always allow you to be healthy at home. That doesn't mean board it in your home. It means you'd still, no matter where we go, be able to get your essentials out in the community. And it also means that you would be able to get out and get the type of exercise that you need. And so, what we're doing tonight on retail is the next step of our Healthy at Home initiative. You are the most healthy right now at your home or around your home. And again, that's just about bringing your contacts in as small as we can of actually one-on-one interaction. What plans are being made to utilize empty motel rooms for either patients or people where it would be needed? We're working on those right now. We're working on a number of locations if they're needed. I do want to thank that community, that hospitality industry for stepping up and for making offers. We are going through all of that planning right now. I am confident that there is, I do have confidence in the food chain supply, which is the next question. There is going to be enough. In fact, it's just we are our own worst enemy in that. The issue isn't that there isn't enough in stores, it's that we take too much when we go to the stores. Remember, your actions have consequences on other people. Let's just be a good neighbor. There's a question here about restrictions for truck drivers at truck stops. We have not gotten this question before. It's something we'll have to look at. Our truck drivers are really important in moving equipment and necessary supplies during this coronavirus, and so we'll have to make sure there is still the ability to do that. Anybody in here? Yes, sir.
In your mind, what's the difference between a shelter-in-place order and your healthy-at-home initiative?
It's, in my mind, what is the difference between a shelter-in-place order and the healthy-at-home initiative? So we've seen states take very different approaches. There was a state that just put out one of these a couple days ago, and when I looked at it, it had a lot of things that we've already done. For the first time, it closed bars and restaurants and public-facing businesses and stopped the non-essential, the elective procedures. We have already done a whole lot of what other states are doing in kind of one major, and sometimes it seems scary, order. We've been doing this as Kentuckians. We've been stepping through it. We've been aggressive, but we've been taking one step, and then we've been taking another step and another step. And I think that's how we get to where we need to be. And it lets us all work into this new, I don't want to say normal because it's not going to be forever. And the more we do, hopefully we can shorten the time that we're going through all of this. I got a couple questions here. What does the governor think of Rand Paul testing positive for the coronavirus? I wish him the best and his family the best. I would just want to make sure that with him having to self-isolate, hopefully they are staying in communication, and we hope that he and everybody else gets through this in the best place possible. I believe right now there's no Democrat, there's no Republican, they're just Americans versus the coronavirus. And even with his vote, that seem to place limitations on getting this aid, we still want him to be healthy. I mean, he's a human being, and we're all in this together. Yes, ma'am.
For the restriction on non-essential retail businesses, are they still able to do things like curbside service, like some of the restaurants and bars are now picking up?
That's a good question. Thank you. It is for the non-essential retail. Can they still do curbside and pick up? The answer is yes. While they can't come into the store to get something, they can order on the phone, online. There can be that curbside pickup. There can also be delivery. So any of these stores that are deemed non-essential, and we'll have that guidance out, it's part of our executive order, can absolutely deliver. And especially for our local businesses, let's band together like we've done our best we can with takeout, and let's do everything we can to help them and their employees get through it.
What steps are you taking to make sure that the state has enough protective gear for nurses and doctors in the hospitals?
So what steps are we taking to make sure there's enough PPE, protective gear for nurses and doctors? We are doing everything we can. We are chasing down every lead. We are pressuring every person. We are making every phone call. It is a problem that there is not enough PPE in this country or in this state. And it does mean what our healthcare workers are doing is that much more special. Now, I'm going to work like heck, and I'm working like heck to make sure every day that we have as much as humanly possible. And we've got some positive potential news that's out there. But again, when I talk about hope, I'm going to make sure that it is fully real and that we are going to level with the people of Kentucky. This is one of our biggest limiting factors about when we can set up that mass testing that everybody wants. If tomorrow we could get millions upon millions of masks and gloves and swabs and the rest, we'd be really close to doing that type of testing. But this is the thing that everyone in the country is facing. And while we don't have it at the moment, the amounts we need, it means what we have is really important. And it means what we have needs to be used on those that are in the worst shape and that need our help the most. Yes?
Are liquor stores included in the non-essential? I think it's different in some states. I didn't know.
Or what type of stores?
Liquor stores?
Liquor stores are excluded from the shutdown. They will still be open.
Hardware stores, banks, veterinarians, are they included in non-essential?
Banks and these are retail stores. So banks are not retail, veterinarians are not retail, and I'll have to get you an answer on hardware. There are stores that on the breakdown that we believe are essential, certainly to home repairs, and we want to make sure that those stay open. I want to close today, and I'll answer one of these other questions that I'm glad today that we didn't add to our death tally, and I hope that won't be something that we have to mention every day. It was hard yesterday announcing that one. We lit up the Mansion Green yesterday, and any other day that we have to make that announcement, we will too. It is a color that is associated with compassion and renewal. And why we're doing this is to protect everyone out there, so hopefully we don't have to make those announcements too often. Now, I got about 4 questions on these, and I'm just going to answer one. And it's, have you seen the meme fan page on Facebook with over 40,000 followers? If it makes people smile right now, I'm for it. We're living in different times, certainly, if that's out there. I'm just glad that we can come together every day at 5 to make sure that we stay calm, because we're facing something that none of us have ever seen, and that you get information directly from me. I know we're going to make it through this. I know we are. And I know it's going to be worth it in the end. I know all of you all are making sacrifices, and if a meme helps to get a laugh at a time that we need more laughs, go for it. I did get a really nice email from a woman making socks, and it was nice that she asked. But if it made her smile and it makes anybody else smile, then good. But I want you all to know that I know that my job right now, while I enjoy those, is really serious. It's about making sure that I do everything I can for all of us out there and for all of our families. And every day I'm doing the best I can, as is our Department of Public Health, as is our Cabinet for Health and Family Services, and everybody else. I hope one day that we could look back on this and say we were really aggressive. And in fact, I hope one day maybe they'll look back and say we were more aggressive than we had to be. That's because we care. That's because I want to make sure we take every step to protect those around us. And as we see more positive cases, and we will, that you have the confidence that we are taking the steps to protect the people that you love. We're going to get there. And we're going to get there by being the really good people that we are. So again, be that model. Fill up social media. Use those hashtags. Be the model of exactly what we need for our people right now. And don't be the exception. Whether it's a business or a medical practice or one pastor that doesn't heed everybody else's sacrifice and brings a bunch of people together that could be the most vulnerable, we have to be better than that. And as we move forward, we got to be strong. We got to be resilient. We got to know that we face something significant, but we got to know that every other generation in this country that has ever been faced with a major challenge has beaten it. And we will do the same. We will pass this test. We will make it. And I look forward to that day where we can all be back within 6 feet of each other. Thank you all very much.